The COVID pandemic, now changing our relationship with something fundamental to our lives: food.
They're there because they're hungry. They're there because they don't have work and they don't have food.
From eating out to eating healthy, the virus is threatening a way of life.
Got to figure out what you can do to save yourself. What parts of your business are you going to have to amputate?
And life itself in an unequal America.
Why is it in the greatest country in the world where we grow enough food and we waste enough food, food is not getting down to the people that need it the most?
Finding ways to hold out and survive. How will this change the future of food in America?
The way that you feed yourself, feed your family, stock your fridge, cook at home has just changed forever.
This is an MSNBC special report, Food and the Pandemic, Recipe for Disaster. Here are Joy Reid and Andrew Zimmern.
Hello, everyone, and welcome. I'm Joy Reid, and joining me for this special program is Andrew Zimmern. Now, you know him as a host of MSNBC's What's Eating America? And we are joining forces to tell you about something that's gotten too little attention as we've all suffered through the coronavirus pandemic over the past 6 months. And it is this: in our land of plenty, we are facing a food crisis.
That's right, Joy. For many Americans, food is something that's too often been taken for granted. We don't have that luxury anymore. The virus has exposed some massive vulnerabilities in American life. The virus has not just attacked people's health, it has shut down large parts of the economy, thrown millions out of work, crippled the restaurant industry, and disrupted the entire food supply chain.
And all of that has put many Americans at greater risk. Those who struggled to put food on the table before the pandemic or had a hard time finding fresh, healthy food. Even many who never had these problems before are now facing a challenge you might have thought was not possible in this country. It is a challenge that cries out for our attention, and we'll be paying close attention to all of these issues over the next hour.
It is shocking, Joy, to think back that April, when you and I first started talking about these matters on Saturday mornings, the issue was on the front page, above the fold of every major newspaper, and in the A or B block of every news show. And then it went underground for the last 5 or 6 months, despite the fact that the need has trebled and the crisis has worsened.
Well, now what we're talking about are people in food lines. People are at the other end of the distribution spectrum and having to stand in line waiting for food. And as we've said, some of whom have never had to do that before because of the way the economy has gone, to say nothing of the restaurant industry and the troubles that are happening there.
That's right. The ripple effects are everywhere. Right now, I'm at the Dark Horse Bar and Eatery in St. Paul, Minnesota. It's just one of hundreds of restaurants barely holding on by a thread here in the Twin Cities. This business, devastated by 2 pandemics, the viral explosion of COVID-19, and also the civil unrest that began after the death of George Floyd while in Minneapolis police custody. Owner Patty Whalen has already had to close his well-known Minneapolis restaurant, Muddy Waters. But even in communities where the protests weren't an economic factor, the pandemic has dramatically changed how we live every day, making getting together in large groups a matter of life and death. Sporting events, concerts, movie theaters, all have taken a hit, but none more so than the restaurant and food service industry, which pre-pandemic was the second largest private employer in the country with more than 15 million workers, second only to the healthcare sector. Gotti Schwartz reports just how bad it really is.
As the pandemic now enters its 7th month, unfortunately, we are getting way too used to seeing boarded up storefronts and restaurants everywhere. And there's a natural tendency for us to see these boarded up storefronts, boarded up restaurants and think things must be bad here, but they must be good at the places that are still open. But what we have found is across the board, whether they are open or closed, they are bleeding money and accumulating debt every day. So you've got 3 restaurants.
Yeah.
Are any of them open?
No.
Greg Morris has been in the restaurant industry for nearly 30 years. But today his bar stools sit empty, his kitchen's quiet. For a while he tried reopening, But in Los Angeles, where only outdoor dining is allowed, there wasn't enough room to come even remotely close to paying his rent. So you're talking about 4 different tables right here.
Yeah, 6 feet apart. Yeah.
He tried takeout and delivery, but lost money there as well. I hate to ask, but how much are you losing?
In the last 5 months of closing, I've probably lost somewhere around 5 million in revenue.
It's a big loss, but even before the pandemic, when business was booming, profit margins for restaurants were razor thin. Before COVID, Greg estimated that the normal monthly sales for one of his restaurants would be about $160,000. After paying his employees, operating costs like food, taxes, insurance, and rent, he's only left with $5,000 of profit. Now, if you factor in the reduced hours and seating capacity during COVID, he figures a $21,000 a month loss.
It's devastating.
So like 12,000 other restaurant owners across the country, he's had to tell his employees that his only chance of surviving this is to temporarily shut down until COVID-19 and its restrictions pass.
Sounds a lot like triage.
It's exactly triage. You got to figure out what you can do to save yourself. What parts of your business are you going to have to amputate?
So many people right now are saying they're going to lose less money by staying closed than by opening. Why?
They're absolutely right.
Yeah. Here in downtown Los Angeles, so many businesses rely on the Staples Center and the big events that are usually held here, but these days, it is depressingly empty. And nearby, Andrea Borgen-Abdallah's restaurant has almost ground to a halt.
Why reopen?
Yeah, you know, our decision really came down to, we have a couple of employees who are really at risk. They could not wait for unemployment to kick in, and it was this job or the street for them.
To keep a couple of her employees working and cover health insurance for her furloughed staff, she's pivoted to retail beer and wine sales and pared down the menu.
Both surviving this pandemic and then also really preparing ourselves for what the future of restaurants is going to look like. No matter who you are on the planet right now, the way that you interact with food, feed yourself, feed your family, stock your fridge, cook at home has just changed forever.
For now, Andrea and thousands of other restaurant owners across the country have been able to make ends meet because many have made the difficult decision to stop paying the rent. They've been able to do that in part because of eviction moratoriums, and that's the same boat here at Gorilla Tacos. They are open for business, but they can't pay the rent. And the owner here, Brittany Valles, says she is in more debt now than she could have ever imagined.
I'm gonna just be super open about it. We pay for the entire building now, and you know, we haven't paid for a while. So we're close to $200,000, and that's like various debts.
And you're 27 years old.
I know, right? What am I gonna do?
The federal Paycheck Protection Program helped carry them through the summer, but that money is due to run out. Thousands of restaurateurs are pushing Congress to pass a $120 billion rescue package. But even if that happens, no one expects things to go back to the way they were. And that leaves millions of workers like Chef Jamie Liu, who has been out of work since March, facing an uncertain future.
I cook for a living. I don't have like $20,000 just like sitting in some savings account, you know? So it's like me putting in the hours every week is like how I make a living. If I can't do that, then I'm kind of stuck. It's not like I can just run out and just get another job. Traditional like models of restaurants just don't work right now.
For now, unemployment checks are helping, and Jamie's turned her home kitchen into a test kitchen for the online meal business she hopes to create.
If none of this had happened, I probably would just be slaving away at a restaurant and too afraid to entertain the idea of becoming a business owner, like honestly. So this kind of was like a really swift kick in the butt that I think I needed.
A dose of reality and a dash of optimism as the restaurant industry wonders what it'll take to survive.
Truly, my big concern is not while we're in this like intense lockdown pandemic state, it's after, because the recovery process is gonna be long. I'm gonna owe a lot of money.
I think that in the decisions that I'm making right now, it's not just for the next 3, 4, 5 months of this pandemic, it's for the future of this restaurant as a whole.
It makes me sad because I think some of the things that I really cherish in this business, like hiring more people, is gonna change. It doesn't have the same magic.
And I want to show you a scene that we've seen play out across the country when we're talking about restaurants trying to make ends meet by expanding out into the roads here in Culver City. You can see they're all the way out here into the street. But even still, this is a place that would be normally packed. We've got one table over here. We've got one table over here. People just aren't coming out to eat as often as they did before. And with that, obviously, you heard about that crippling debt that continues to grow. Everyone we've spoken to in the restaurant industry says that without a massive bailout, they're expecting things only to get worse. Guys, back to you.
Gotti, thanks. Wow. And Gotti's piece really highlights the resiliency and a spirit of survival, giving us hope that all is not lost yet. Joining us now is Stephanie March, food and dining editor for Minneapolis St. Paul Magazine, and Katie Button, a chef, member of the Independent Restaurant Coalition and CEO of the Katie Button Restaurants Group, based out of Asheville, North Carolina. And both of you, thanks for being here. And Katie, I'll just start with you. What will new normal look like, do you think?
Well, I mean, we're currently open, so we're kind of facing what new normal looks like now. And new normal looks like not being able to break even and survive this pandemic. So it's pretty stark out there. I mean, a lot of us have received PPP funding, and that's getting us through. It's making up the difference of our losses right now, but we're rapidly coming to the end of that money, and there's no way that we can make it.
Katie, how important to you is the bailout that Gotti suggested at the end of his piece? He's referring to the Restaurants Act that is now sitting on Capitol Hill, $120 billion backstopping of the restaurant industry. Is that really the only solution long-term for the industry?
Yes, it is extremely important. It was crafted with the mindset of a restaurant business and how we're being uniquely impacted in this time with our reduced occupancies, sometimes alcohol curfews, many people who still aren't able to open for in-space dining, and our guests are being told frequently not to go to bars and restaurants for their own safety. So, I mean, really, our industry will not survive if we do not get the Restaurants Act passed now.
And Stephanie, talk to us a little bit about, there is a lot of fear out there. And I have, friends in the restaurant business, and, they even acknowledge that a lot of people are afraid to go out and eat, even if it is outdoors. What needs to happen in terms of bringing back customer confidence so that people want to support these restaurants? These are restaurants of people that they know. They're part of these communities. How do you get back the confidence that people used to feel in eating out?
A lot of it has to do with just making sure that everybody is very communicative. You need to be upfront. And I think that restaurants, it's hard for them because they've kind of found themselves in a place where they have to sort of police people. And suddenly places that have always been about yes, yes, are suddenly about no. Well, you can only have 4 people at this table, and we can't seat you over here, and you must wear a mask when you come in. And so I think there's an adjustment that has been sort of working within the industry. They want to provide that confidence that they are safe and that they're going to create a safe environment. And they also have to figure out how to communicate and work with the guests who are coming in so that it's an agreement.
Stephanie, that's the public forward-facing piece of this. But behind the scenes, restaurants have been extremely brittle financially for going on decades now. One of the big trends that we're seeing is the rise of the discussion again about the tipping issues, whether they're going to go with service surcharges, whether they're going to go with some sort of other way in which to compensate employees. Mm-hmm. What are you hearing here in the Twin Cities?
We're moving, a lot of these people are moving towards, the restaurateurs are moving toward the service charge in order to be able to, really sort of pay everybody in the restaurant, not just, compensating the servers. And I feel like a lot of the guests have really sort of, as we've all seen them move towards supporting restaurants as a whole instead of, during this time, they think, let's help everybody out. So I feel like the service charge from a guest perspective is being really welcomed as a way to sort of give everybody an equal chance.
And Katie, let's talk a little bit about, the thing that needs to happen in order for the Restaurants Act to pass, in order for, money to get, into the hands of businesses like yours who need it, or that the politics has to move. Mark Meadows, who is now Chief of Staff to the President of the United States, used to be a congressman. And when he was in Congress, he was a very prominent member of the Freedom Caucus. And their sort of big touchstone was not spending federal money, is taking in as little as possible and spending as little as possible. He's from your state. Do you think that having seen what's happened to businesses like yours in his own community, that is changing at all? Or is the attitude, because it does, I think, feel to a lot of people when you look at what Senator Mitch McConnell is doing, what a lot of Republicans are doing in Congress, is saying, we don't want to spend, even if it's to save these businesses. Do you feel that changing on the ground?
Well, I have to say, and Mark Meadows is actually right from our area in Western North Carolina, so I know him pretty well. But anyway, the thing is that what's happening right now is Congress is debating what to do next, but it's taking too long. And we're in this moment where it feels like they're waiting to see the damage that is done before they're going to make a decision. And the problem with that is that we are facing a catastrophic closure event for independent restaurants across the entire country. And what I'm saying, like right now, the PPP money, you're seeing restaurants like operating as takeout, doing some dine-in, doing some outdoor dining, and it's giving people, the public, and our members of Congress a false sense of security that we're making it, and we're not. The numbers don't add up, and we need the funding to be able to continue to employ our workers, continue to pay our farmers. Restaurants are an enormous economic engine, and when you give $1 to a restaurant, 90 to 95% of every single dollar given to us goes right back out the door to our employees and our farmers and suppliers. And so we are a way of driving, an economic kind of bolster to get us through this. And I really think that you think about what would happen if we don't give this money to restaurants now and do it today, not tomorrow when we're closed. I mean, that's what's going to help us all as a country get through this.
Indeed. Well, hopefully Washington is listening. Stephanie March, Katie Button, all the best to both of you. Thank you so much for being here. We're going to take a quick break here, but we have a lot to get to. And when we come back, a look at how economic inequality means food inequality, made worse by the pandemic. And we'll meet someone who's doing something about it. And later, the country music legend who's doing what he can to feed his corner of America. Welcome back to Food and the Pandemic. The coronavirus does more than make people sick. It makes life harder in other ways, too, especially for people who were struggling even before the pandemic hit. And it's unlikely to improve anytime soon. Amid news this week that the latest COVID relief bill has failed in Congress. More often than not, that means communities of color where access to fresh, high-quality, affordable food was difficult to begin with. It's called food insecurity, and it affects 11% of households in this country. Recently, I've spent some time with someone who's working hard to make these things better. I'd like you to meet Karen Washington.
Black dirt. It's nice, it's warm, so you can see the organic matter in here, how this is vibrant soil.
The soil is where Karen Washington has found her calling.
There's something about the power that you feel of farming, the element, there's something in here that makes you feel good about what you're doing.
We recently visited Washington, the godmother of urban farming, as some call her, at her Rise and Root farm in Chester, New York.
To our left, we're growing a lot of our tomatoes.
I see the tomatoes. Those are good-looking tomatoes.
Yep, and they taste good, too.
A physical therapist by training, Washington didn't set out to be a farmer. But in 1985, this single mother of two bought her first home, a row house in the Bronx with a backyard.
I decided moving to the Bronx, had a backyard, let me try and grow 3 things. Tomato is one, collard greens, because you know how to grow collard greens because of my people, and eggplant because it sounds funky.
With nurturing and a lot of hard work, Washington's backyard garden grew, and her first batch of tomatoes was for her a defining moment.
When I bit into it, oh my goodness, the ray of sunshine, it changed my world. That I wanted to grow everything.
And then she did, turning a vacant lot across the street into a community garden.
She wants some collard greens, see? Collard greens.
Every week, she brings her produce to a farmer's market in the South Bronx, where the need for healthy food is urgent. The USDA has designated the South Bronx as a food desert, defined as a low-income area where people have to travel more than a mile to reach a supermarket. Some 23 million Americans live in food deserts. A disproportionate number of those Americans are Black.
A lot of supermarkets don't want to come into low-income neighborhood. They've been told that if you come into a low-income neighborhood, you're not going to make money. And the fact of the matter, if you look at per capita, people are willing to pay for food. People are willing to pay for good food if you give them good food.
You use the term food apartheid. What is that?
I wanted people to talk about the food system and the systemic changes that it has to happen, that we need to talk about the influence of race, economics, and demographics, and start having those hard conversations around the food system. Why is it in the greatest country in the world where we grow enough food and we waste enough food, food is not getting down to the people that need it the most?
Washington says the food system is making people sick and vulnerable to the coronavirus.
In this era where COVID-19 is disproportionately affecting Black and brown, indigenous people, is there a connection between the food availability, the fresh food availability, and this increased propensity to be afflicted by things like COVID?
This pandemic has brought to the surface some of the inequities that we see. Most of the people, especially in my neighborhood, are bounded by a food system that is charity-based and subsidized-based. And what I mean is that a lot of the cheap food, the food that's not nutritious, comes into our neighborhood. Right now, we have people who have type 2 diabetes, hypertension, and end-stage renal diseases, all these things that affect our community. So what we need to do is, how do we heal our bodies? We heal our bodies by eating fresh produce.
And while a well-stocked supermarket could help fix the problem, Washington believes the community can no longer afford to wait.
So we say to that, you know what, forget about the supermarkets coming into our neighborhoods. Let's start doing food co-ops that we're trying to. Let's start opening up our own stores that look like us, because we know exactly what people want. We grow the best vegetables.
To ensure this happens, Washington has helped to create a Black Farmers Fund to develop a new generation of Black farmers.
Out of 57,000 farmers in New York State, only 139 are Black.
In fact, fewer than 2% of American farmers are Black, down from a peak of 14% in 1910, a decline blamed in part on discrimination and institutionalized racism. Washington's Black Farmers Fund will not only teach farming techniques, but leadership skills too.
We're pulling all our resources, all our money together so that we can help the next generation of farmers and Black businesses grow. And if we put our resources together and we put our money together, we can move mountains and we can move this economy without being beholden to it. We have Thai basil.
With that momentum, Karen Washington is changing the face of the American food industry to try and ensure that all Americans have equal opportunity to eat healthy.
And for me, it's not about the labor, even though the labor is hard. But at the end of the day, to just sit back and say, you know, you did something to make the world a little bit better.
Wow. What a fantastic piece. You know, race and food intersect absolutely everywhere we look in America, from the rise of the dollar stores that are exacerbating the lack of access to healthy, nutritious food, all the way to the racist notion that communities of color don't know how to eat well. So many things that Karen talked about in that piece. We're identifying so many of the problems as well as solutions. Did you get a sense from her that she's hopeful now that this moment in time we actually might make some progress?
Well, you know, Karen is a remarkable person, you know, and it's 4 women. It's not just Karen, but there are 4 women who are in this endeavor trying to sort of bring farming to the average person. She's hopeful in the sense that she knows she's doing something about it, right? I mean, she talks about food apartheid, which goes all the way back to the idea that black people were brought here to do all the farming and yet own almost no land to farm on, own almost none of the land from which our food is created. So she's trying to change that by creating more opportunities for black people to get back into farming, to allow black people to have ownership and not just be workers, but be owners, and to be producing the food for black communities, and to solve the problems that she says supermarkets can't solve. So she's hopeful in the sense that she knows she's active and she's doing something about it. And she's a remarkable person, and what they're doing on that farm is incredible.
She is one of my heroes, and the 400-year-old issue of slavery agronomics are still plaguing us today. It needs to be a front and center pivotal idea that all Americans understand. What a great piece. Up next, our medical experts on how poor nutrition, which we've now seen, affects a disproportionate amount of people of color, makes it even worse when a pandemic strikes.
So this year's election is going to be a little different.
Instead of one election day, we now have a voting season.
That special time of year
when polls can open weeks before Election Day.
When your mailbox can become a voting booth.
When how you vote is just as important as who you vote for.
But how, when, and where you cast your ballot all depends on your state.
'Tis the season to be prepared.
This year, plan your vote.
Welcome back to Food in the Pandemic. We continue our discussion about the disproportionate way that COVID affects communities of color, and it starts with the inequities in the food eaten by those communities. Joining us now, Dr. Nahid Bhadelia, Medical Director of the Special Pathogens Unit at Boston Medical Center and Global Health Security Expert. She's also an MSNBC medical contributor. And Gregory Gottlieb, Director of the Feinstein International Center at Tufts Friedman School of Nutrition, Science and Policy, and Professor of Nutrition and Human Security.
And let's just jump right in. Dr. Bhadelia, I want to start with you. Can you just talk about the ways in which, I mean, we see communities of color, particularly black and brown and indigenous communities, facing a higher COVID death rate. We also hear this anecdotal, well, you know, if people have diabetes or people have hypertension, that's the reason it's more deadly for communities of color. But can you draw a link between those two facts and the food that's available, particularly to low-income communities of color?
Thanks so much, Joy. So, you know, you have this statistic from the CDC that says 94% of the people who died of COVID-19 have a medical condition. You know, and what often doesn't get mentioned is how many Americans have medical conditions that put them at high risk for severe COVID-19. 40% of Americans are obese. 1 out of 10 have diabetes. 30% have hypertension. All of those aspects are borne with greater intensity by communities of color and socially disadvantaged and economically disadvantaged communities, partly because of the lack of access to good food, partly because inability to access healthcare with the same level of accessibility, the structural racism in our healthcare system, as well as the risk that they are placed in due to the position they're in at work, potentially as essential workers, as frontline workers. The link between obesity in particular and hypertension, what we've seen with obesity is that obesity is a chronic state of inflammation. That and diabetes both are thought to change the way our body and immune system respond to an infection.
I have a question for both of you, if you could address it. It seems to me that, like so many other things, COVID-19 has just peeled back more of the problem, and certainly in the case of actual comorbidities, made things worse for people with COVID. But we're spending $1.5 trillion, maybe more dollars a year fighting the big 4 food diseases. How is it that we can actually make some progress there so that the next disease roll around, the next pandemic, we actually make America healthier?
So part of what pandemics do is they affect all aspects of food production, distribution, accessibility. And we've already talked about the underlying risk, right? Here, what's happening is a lot of the food production workers are people of color, people who come from socially disadvantaged communities. So everybody from groups such as migrant farm workers to grocery workers to restaurant workers, those frontline workers during this pandemic have been placed at a greater risk. So one of the statistics that sort of blew me away is from the Union of Food and Commercial Workers that said that in the first 100 days of this pandemic, you basically had 11.5 thousand grocery workers get sick from COVID-19.
And Gregory, if I could just ask you a follow-up question, as you are a nutritionist, as my mother was, so I respect very much what you do for a living. Talk to the people who are getting their food now, not from the store, but from food banks. People are having to make choices not from what they would like to buy, but from what they're able to get. Is it possible to eat in a way that is healthy enough to try to guard against COVID when you are not eating by choice?
I think it's very difficult for a lot of families to do that. First of all, I think families have to know, they have to be aware what good nutrition is and which products provide them with the right balance. I think that's the important concept that we have to get across. That's why, at least from my school, there's a lot of education that goes into what makes a really good and balanced diet for folks. And I think that would be a big part of it. The fact that people have to go and get food in a place where they don't have the broadest of choices is really problematic and will take on, I think, on our part, a lot of education.
Absolutely. It is a complex problem. Dr. Nahid Bhadelia, Gregory Gottlieb, thank you both very much. And when we come back, the shocking scenes becoming all too familiar now because of COVID. Americans by the hundreds of thousands, as we just discussed, waiting in line to get food.
America has long seen itself as a land of plenty, a place where no one need go hungry, a chicken in every pot. Depression-era black and white memories of bread lines and soup kitchens were a thing of the past. But thanks to the pandemic, we are now seeing a 21st century version of hardship, with millions of people out of work and in need of help just to put food on the table, many for the first time in their lives.
In a minute, we're going to see what everyday Americans are doing to help and hear from country superstar Brad Paisley about his efforts to create a free grocery store in Nashville.
There is some relief for those suffering from this side effect of the pandemic. Food banks across the country benefiting from a surplus of supply that would have gone to restaurants now shut down. But the question remains whether they can keep up with the new demand. It's a day they will never forget. The San Antonio Food Bank was expecting a big turnout, especially since the pandemic had tripled unemployment here. But by daybreak, Michael Guerra and his staff realized they had awakened to a nightmare.
Cars started lining up the morning before, so they'd been there 18 hours, 12 hours, and then they sat in line. They sat in line. Cars were breaking down, cars were running out of gas.
Each car, a family in need.
Your heart stops. They're there because they're hungry. They're there because they don't have work and they don't have food.
It was April 9th. On the Christian calendar, that's Holy Thursday, marking the Last Supper. At the San Antonio Food Bank, it's also remembered as a day from hell, as temperatures soared.
By the afternoon shift, volunteers were dropping. Literally, ambulances were coming because of people having heat exhaustion. There we go.
Food Bank President Eric Cooper.
I saw the line backed up on the freeway, and I drove for mile and mile and mile, and the line was just, I wasn't hitting the end of it, and so I panicked.
More than 10,000 cars went through. This was the richest nation on earth, and it was shocking.
We're a hard-working, poor economy. Multi-job, uninsured, just hard-working, right on the edge, but making it. I mean, just surviving and making it without help. COVID-19 pushed those families that were on the edge over that edge.
To try to stay ahead of demand, the San Antonio Food Bank has its own small farms. All summer, volunteers were out in the fields planting. Soon, these crops will feed another line of families.
God bless them and their families.
But the need here is actually greater than ever. On our visit, with the temperature over 100 degrees in the shade, the line crawled along for hours. And then, from out of nowhere,
here comes a 75-year-old woman on her walker from the bus stop, and she just wants a little food. That shows the desperation. And then it's people of every color, every gender. It's the diverse rainbow of San Antonio.
One possible reason for the desperate situation, the cutoff of half of the $600 extra unemployment benefit. And Congress is still deadlocked on what to do next. 125,000 more residents are now being served each month. Most of them first-time recipients.
I've never done it. I worked and I don't have a job anymore. Well, this is a blessing, and I'm glad to be part of it.
The pandemic has severely damaged San Antonio's economy, especially hotels, restaurants, and bars.
The hospitality and tourism industry here has been decimated. Hotels empty, Riverwalk zero, conventions gone.
Among the first-time recipients we met at the food bank was a mother of 5, Michelle Abraham, who works 2 minimum wage jobs. She's struggling to feed the 7 members of her family. Her sons lost their restaurant jobs due to the pandemic, and now she is the only one working. After rent and her other bills, Michelle has only $70 a week to feed them all.
It's hard. I mean, it's really hard.
She recently broke down, she says, crying in the shower, worried how she could possibly make it. She's one of thousands here who never thought they'd ask for help. Not in a million years.
Oh, no, never. Because I've always worked. I've always taken care of my family by myself, and we've always made it.
A survey of young mothers this spring found that some 14 million American children were not getting enough to eat. And the San Antonio Food Bank estimates 1 in 3 children here are undernourished. Michelle Abraham's 6-year-old son, Jax, is blissfully unaware how tough it was for his mom to get him his healthy treats.
Remember the other day when I honked for everybody to come in and we had all those cherries and the pineapple and the mango and stuff that I told you I went to the food bank?
Yeah.
At the San Antonio Food Bank, they have a 360-degree holistic approach to bring people hope. They give guidance on all available forms of help, from food stamps to women's and infants programs to work. And in a program utilizing an app called Shift Smart, unemployed workers like Heather Martinez can now get paid $13 an hour to work here. They're filling in for many of the regular food bank volunteers who are older and at risk for COVID-19.
And if y'all can go ahead and start bagging them all back here, please.
Martinez used to work at a restaurant and now runs the distribution line here. She says the program has been a lifesaver.
We're able to not only get paid, but they're giving us a steady income now during this time of not having any jobs or anything like that.
The food bank is also training people who need jobs. Mac Richardson is a homeless veteran who's taking classes in the food bank's culinary arts program and volunteering to feed others. Recently, a box of bananas was given to Michelle Abraham, and she got back to us with a video of her mom making a banana nut bread they would not have been able to buy. It was just a small treat, a little gift of food, but more.
Something like this it's awesome. It'll bring a lot of people, a lot of families, not just the food itself, but hope, a blessing, and some peace.
That's such a staggering story to see, Joy. And I think what impresses me the most was that, 5-6 months ago, the picture of the line, the aerial picture of the San Antonio Food Bank was the one that was on the front page of the New York Times and on every newscast in America. And the problem has only gotten worse. It grabbed America's attention then, and I'm praying that it grabs America's attention now.
Absolutely. I mean, the one piece of good news is that, this country, and you and I have talked about this, Andrew, has so much food waste. We have enough food waste to feed a smaller country, right? And so what we're seeing now is this cooperation to make sure that food is not thrown away, which is a sin, and to see it actually going to feed people. It's a massive effort. It needs to be bigger. And as you said, it needs to be talked about a lot more often. That was a great package. And meanwhile, as food banks nationwide struggle to keep up with those longer lines, celebrities are stepping up to help. Country superstar Brad Paisley and his wife, actress Kimberly Williams Paisley, have opened The Store in their hometown of Nashville, Tennessee. Its concept is simple: offer free, fresh food to area residents, including home delivery to the elderly. And I had the chance to speak with Brad about it.
We really were early on this. I mean, 3 years ago, we started working on this concept, never imagining that we would be ready just in time for the worst crisis of our lifetime. It's truly sort of divine. We got the inspiration from a place in Santa Barbara called Unity Shop. And their model was this. It was basically a free grocery store for people that fall on hard times. They should be able to go through our store, have the dignity that comes with the choice. You have choice in the food that you pick. You are able to have a shopping experience that your children feel like is very normal, and they're not aware that at the end of your sort of shopping, you don't pay for anything. The kids, there's a checkout counter, there's a little mechanical horse. It's a very dignified experience, and it helps the parents get back on their feet. And the goal of this also is that they go through the system through this hard time, and then they graduate out of it. They find a job, they end up in a better situation, and we've seen that happen with the one we based this on, and already it's just the need has been 5 times what we expected.
Yeah. I finally got a chance to be in Nashville last year for the first time. It's such an incredible city, and one of the things that, the first thing people think about, obviously, and of your fans, obviously, that are watching this, think about music, think about all of the incredible entertainers that are there, the incredible, spirit of Nashville. Can you talk a little bit about, where all of these needs are coming from? Because, I know musicians are having a really hard time right now. Independent musicians are having a hard time right now. People who are involved in that industry, restaurants, there's like these cycles that are really hitting so hard. Are you seeing more people from those communities that are using the places like The Store and having to really for the first time?
Well, Nashville is in pain. I mean, my industry has been hit harder than anything I can imagine. I mean, just the fact that we are not able to play concerts of almost any size. For a while, we couldn't record. There are so many out-of-work musicians that aren't doing anything. We're serving some of them, but largely our clientele so far, we have a very high percentage of minority clients, large African-American clientele, but I do think that the music business is, they're kind of hanging on tooth and nail right now, people that were employed, but we're all starting to sweat, like, when is the next concert? When's the next tour? There are people that do lighting, people that do video work out on the road. There are people that do truck driving, bus driving, everything. I mean, you name it, roadies, they're all out of work. So we are serving some of them, but yeah, I mean, it's just the needs rising every day.
Yeah, absolutely. And I know that, I think we all kind of held our breath when the CARES Act expired in July. I mean, I know a lot of restaurant owners who are struggling, and this is in New York, a much bigger sort of market where they're able to kind of hang on. But I'm sure things are really, really tough in Nashville as well. And I know you guys saw like a 20% increase in demand. Nearly 9 in 10 of the families that are being helped are people who are unemployed. What would you like to see done at the federal level that would really help the people in Nashville, the people that you're serving?
I look back and I think, what would have been an amazing thing would have been to sort of identify the businesses that are dependent on gatherings. Like when you think about the music business, we are dependent, most of our livelihood in our town is dependent on the ability of people to get together and listen to music. Otherwise, there are 40 or 50 people on any given tour that don't get to go to work. And so it would have been an amazing thing to have some sort of stimulus that really sort of injects right into things like, theaters and movie theaters and music venues and touring companies and heck, theme parks, you name it. Something that sort of strategically targets these things that could get us as a stopgap to the day when we're able to sort of say, okay, this amount of people are okay, let's go play.
Yeah. Brad Paisley, you're a good guy. I know your fans really miss being able to see you in a show. Hopefully that'll happen soon. Thank you. And your wife, Kimberly, God bless y'all for what you're doing. Thank you for being here with us.
Thank you for having us on to talk about this. It really means a lot.
Coming up, our salute to unsung food workers on the front lines of the pandemic. Welcome back. We've talked a lot this hour about the most vulnerable Americans struggling to stay afloat due to the pandemic. But for every story of desperation, there are stories that give us hope, like those choosing to use their time to help nourish others in need. Whether it's feeding restaurant employees who have lost their jobs, kids who depend on school lunches, or the vulnerable who can't leave their homes, food workers are another critical group on the front lines fighting this disease. Essential workers consistently taken for granted and undervalued.
We was hearing through the industry that everyone was losing their jobs. We started a meal program here. We just grew just out of control. The restaurant workers that didn't know where their next meal was coming from kind of like relied on us.
We decided to flip Olmsted into a food bank for anyone that needed it. We partnered with World Central Kitchen, and we kind of had to keep evolving, both to help the community and to help our staff, but also just to help the business survive this year.
There was this incredible group of industrious volunteers that showed up just eager to do something, to see all of these beautiful meals come out of our kitchen, which had basically been vacant. And then it was this hive of activity. It was incredibly nourishing.
The snowball effect was wonderful. People heard about the donations and that we were feeding essential workers. To show up to the pharmacies or the hospital or the nursing home with food and smiles on our faces coming from complete strangers, well, that's what Kailua and Hawaii is really all about.
Allowing us to help the community to be able to get a meal, something to eat. We definitely bring you the essentials straight to your door.
There's many families out there that are struggling because they've been laid off from their job, and they really appreciate the support that we're giving them.
It's important to nourish others in need because we're one phone call away from being in the same position as they are. It's no fault of their own that they're on these food lines.
We are still able to serve. We are still able to make someone's day. We are still able to provide quality food to those in need. It has been a privilege to be a part of the community that needs us most right now.
And to learn more about how you can help, here are two places to check out: Feeding America, which supports a network of food banks across the country, and the Independent Restaurant Coalition.
Andrew, the reason I love doing specials and talking with you is you're about solutions, man. And I'm really glad that we ended this hour with something that people can actually do, because I think that's what people want. So thank you very much. And on behalf of Andrew and me, thank you for spending this hour with us. Have a good night.